I'm joined today by the Houston Health Department Director Stephen Williams, the City's Medical Director Dr. Purse, Mino Davis from our Office of Human Trafficking and Domestic Violence Initiative, Chief Pena with the Fire Department, Assistant Chief Wendy Bambridge, and then HPD Lieutenant Julia Pleasant, and others who are gathering with the city on an important initiative. First, I want to provide an update on the City of Houston's COVID-19 numbers. The Houston Health Department reports 367 cases of COVID-19 today, bringing Houston's total to 87,566. There is one newly reported death, bringing the city's total to 1,374. The person who died was an Hispanic male between 40 and 49 with underlying health conditions. Today, Houston's positivity rate is 6.9%. If you can recall last week, this time it was 6.7, so it inched up ever so slightly from last week. That number is still too high, and again, the goal is to return to 5% or less. Our positivity rate is very important, so let me remind people to keep these masks on and to engage in social distance. COVID-19 has changed our reality, and we must continue to change our behavior to meet this new reality. We know what's happening all around us throughout the country, even in places like West Texas, El Paso, and so we need to do our part to make sure that this virus remains in a manageable state. To remind us all of the importance of doing these things every single day, the Houston Health Department today launches Phase 2 of its public health campaign, Don't Stop, Don't Forget. We have two videos to show, like Better Together, Don't Stop, Don't Forget, includes multilingual advertising across radio, TV, print, social media, website, and billboards. Let me pause for the two videos.
Small things we can't forget to do, or we can't afford not to do. We embed them in our brains. We repeat, for our safety, for our family's safety. We just added a few more for everyone's safety. Remember, every time helps, every day counts. Mask up, social distance, wash your hands, get tested, don't stop, don't forget.
Todos tenemos nuestras pequeñas rutinas. Cosas que hacemos casi sin pensar y que no podemos olvidar. Que repetimos una y otra vez por nuestra seguridad y por la de nuestra familia. Ahora tuvimos que añadir algunas más para proteger a todos. Cada día cuenta. No te olvides. Ponte la máscara. Distánciate. Lávate las manos. Hazte la prueba. Hazlo siempre. Haz que cuente.
Moving forward on today's other announcement, the COVID-19 pandemic has created significant challenges in our community, and the city has responded with programs and funding provided by the CARES Act to directly benefit our most vulnerable Houstonians. Today, we are intensifying our efforts to address domestic violence, where we are seeing a rising number of cases during the pandemic. The Mental Health Division of the Houston Health Department, Crisis Intervention Response Team, and community partners will enhance their reach to serve more domestic abuse victims and those suffering from mental or emotional illnesses. This public health and law enforcement initiative is intended to better address the emotional and mental stress that is at an all-time high level in our community. People have lost their jobs, they're at home more, people are facing substance abuse or homelessness. The Domestic Violence Response Initiative is needed now more than ever, given that COVID-19 has negatively impacted Houstonians, especially where the victim's partner's work schedule has been strained, resulting in increased financial hardship and stress in intimate partner relationships. Recognizing what we are confronting, we are putting $6.2 million in CARES Act funding to assist victims of domestic violence. We do know that domestic violence offenses have increased to 9.39% in March, 3.79% in April, and 15.15% 15.51% in May as compared to the same months in 2019. And domestic service calls are more violent than pre-pandemic incidents. Calls related to family violence, such as aggravated assault, have increased by 48%. Victim advocates are more frequently conducting their own scene crisis response and interviewing in hospitals because victims are being immediately transported via ambulance from the scene due to the severity of the domestic incident. Suicides have increased 8% during the same period. Mental health-related calls are projected to exceed 45,000 crisis intervention calls in 2020, an increase of 5,000 over last year. The additional funding will allow for CERT crisis intervention response teams and DART domestic abuse response teams to respond to more calls. A CERT team pairs an HPD officer with a master-level clinician from the Harris Center of Mental Health and Intellectual and Developmental Disabilities, formerly MHMRA. HPD has currently 12 teams. In addition to their knowledge of mental illness and counseling experience, the clinicians have direct access to consumers' medical data, and the Harris Center and Harris County Hospital District systems. A DART team pairs an HPD officer and victim advocates with the goal of providing crisis intervention for domestic violence victims within minutes of a 911 call. By reducing response time to domestic violence victims, HPD will be able to more quickly connect abuse victims with community partners who will provide resources such as emergency housing, short and long-term counseling, legal advocacy, access to free health care, including forensic medical exams or case management. I want to introduce you to Houston Health Director Stephen Williams, who will be followed by HPD Assistant Chief Bambridge, who will speak to CERT. Then Lieutenant Pleasant will speak briefly on the DART program. Stephen Williams.
Thank you, Mayor. Good afternoon. I'm Stephen Williams, the Director of the Houston Health Department. Mayor Turner described what resources to address domestic violence why they are so vital, especially during the COVID-19 pandemic. The initiatives discussed today both create new programs, but they also support existing resources to address domestic violence crisis. The Houston Health Department is proud to provide financial support to Houston Area Women's Center Domestic Violence and Sexual Abuse Hotline with CARES funding. The total number of daily domestic violence calls the center receives increased about 38% from May to September of this year. The number of daily callers needing immediate shelter is also up. Historically, the holiday seasons mark an increase in requests for services, which could further strain our system. This is clear and increasing a public health threat and why the Houston Health Department is helping. These CARES dollars will help the Houston Area Women's Center support the needed increase in advocates and equipment for the hotline. People experiencing domestic violence can call 713-528-2121, 713-528-2121 for immediate help and support.
Good afternoon. My name is Wendy Bainbridge, Assistant Chief with the Houston Police Department. HPD often collaborates with other agencies to be more effective and responsive to our communities. A collaborative response model enables our citizens to get the help that they need from outside resources that is often at the core reason for a law enforcement response. By addressing these core issues and connecting the victims to resources, we enable our public to have a more permanent resolution, thereby reducing the need for a future police response. The programs Mayor Turner just described, our HPD's program, our CERT program, which we've had since 2008, and our newest arrival, our DART program, and that's the Domestic Abuse Response Team. Our CERT program is housed in our mental health division among several other innovative strategies that we have in responding to those with a mental illness. As the mayor stated, we have 12 such teams, and that's not enough. Each team has a clinician and an HPD officer in the call for service loop responding to calls. But we've had 40,000 calls last year alone, and we're rising, expected to be 45,000 this year. And so each team is unable to respond to all of these calls. So this funding will greatly help. Since COVID, we have seen an increase in our mental health related calls. We've had an 18% increase with an 8% increase in our suicides. And so having these clinicians at these scenes, connecting these families, not only do they help the person that's calling, but also the family members to resources that for continuity of care. It gets them into a different program instead of using the HPD call for service loop. It's a more permanent response and it's a better service to our public. CERT now handles just a fraction of them, as I noted, and this overtime will allow another 417 CERT teams out in patrol until the end of the year. And so with that, I would like to thank Mayor Turner and also Stephen Williams, the Director of Houston Health, for this program. And it will greatly enhance our innovative strategies and our response to the public for a more permanent response. It's just a better program instead of just sending an HPD officer. Now I'd like to introduce Lieutenant Julie Pleasant, and she's here to talk about the DART program.
Thank you, Chief. Good afternoon, everyone. I'm Julie Pleasant. I'm the lieutenant over the Victim Services Unit for the Houston Police Department. What DART is better known as DART, but it is the Domestic Abuse Response Team, and it's more than just an officer and an advocate responding to the call when a unit asks for assistance. As we all know, victims very commonly feel scared and alone when patrol officers leave that scene. So we bring an advocate to the scene, to that residence, to answer what will happen next. What will happen next? The DART unit advocate will do an immediate on-scene needs and safety assessment. If that victim needs immediate medical assistance and for whatever reason does not want to go to the hospital, we have a team of forensic nurses that ride with a supervisor unit. They will be able to come to the scene and provide a free domestic abuse forensic exam. And then that will follow the chain of custody so that that is able to be used in a court of law when the offender comes to court. And those forensic nurses will testify. That will put the burden less on the victim and more on the offender. The other thing it will avoid is a 2 to 3 hour wait for a domestic violence medical exam because there's only a county hospital that provides that right now. So an excellent resource. The victim is then informed how the police investigation will proceed, and they're able to be linked immediately for emergency medical services with community providers, follow-up care on funding for medical assistance, legal assistance, U-Visa assistance, and emergency shelter or long-term housing. The DART is a collaborative approach for wraparound services with our community partners and resources, and that's real time. So you're sitting with an advocate, you're going over all the information, and we do direct referrals to the Houston Area Women's Center, Empowered Survivor, Montrose Center, Harris County Domestic Violence Coordinating Council, and The Bridge, to name just a few. Our partners for forensic exams are REMAX Medical and the Texas Nurse Forensic Examiners. They will provide all those immediate needs, food and clothing, transportation services, and assistance with legal emergency protective orders, divorces, and child custody. So it is a collaborative approach that we're very excited to extend overtime funding to enhance the program. And without these partnerships, the program could not and would not be a success. So we want to thank again Mayor Turner and Director for allowing us to have the funding to accentuate our services.
Thank you, Lieutenant. Let me call on Mina Patel-Davis, who is the Mayor's Special Advisor dealing with human trafficking and domestic violence.
So thank you, everyone, for coming. You know, we're so glad to see this kind of expanded response building on the work that HPD has been doing in this arena for quite some time. And we also know that sometimes when HPD is responding, oftentimes things have reached a point of no return. So soon we'll also be making some things available to get to folks, both abusers and victims of domestic violence, before it reaches that point, and we'll have more information on that soon. Thank you so much.
Thank you. There are a number of things that are taking place as it relates to this COVID that has exacerbated many of the things that we are dealing with over and above what we're used to dealing with. Hopefully, things will be happening that will, I guess, start to bring this virus to an end, put it behind us rather than in front of us. And I think more to speak to that and to the announcement with regards to the Pfizer, the vaccine that may be coming soon. Let me bring up Dr. Peirce, and he can speak to that and on any other matters that relates.
Thank you, Mayor. And yes, COVID is still here, and we reported more cases today and tragically another death. But there is a little bit of light on the horizon, and that is that Pfizer today announced that they had, this is their first interim report. So as research studies go, there are committees that monitor the research. And so this was their first report. And it came out showing that they're telling us that 90% of the infections amongst those who were enrolled in the trial were amongst what we call the control arm, the people who were not vaccinated, and only 10% were amongst those who were vaccinated. And so they were saying that's showing a 90% success rate. So this is early. This is good news, but this is early. Let me point out that 90% is a very high value, much higher than I think most people had expected. But it's early, so we need to let the trial go to completion, and Pfizer has already pointed out that their trial is not complete. But this is a first interim analysis. And so this is very good news. Part of the trial that I want people to recognize is that during this trial they added additional groups. And so this is one of the trials that's actually being done on people as young as 12 years old. So that's another benefit, another plus with this trial. So a lot of hope to be held. Now, the downside is that the trial won't be done. It's not done now, and it won't be done for a little while. And then there's going to be some safety analysis. So we're talking about the efficacy of the vaccine, which appears to be very high. They did not comment on the safety. That is to come. Now, there's no reason to think they haven't had to stop this trial, like a couple of others had to be stopped. They have not had to stop this trial. So that's good news, but the safety part absolutely needs to be done. And the FDA and the Committee on Immunization Practices, which is a part of the FDA and the CDC will make the final determination on that. And so unfortunately, while this is good news, unfortunately I think we need to keep in mind that the virus is still here. We need to continue wearing our masks. We need to do all of the things that were in the videos that were shown. We need to make it part of our routine. Let us not get distracted by this good news on the vaccine and drop our guard. If anything, as we enter into the part of the season where we're going to be gathering indoors more because it's cold, we're going to be gathering in family groups more because of the holidays, we've got schools opening, these are all things that the virus will take advantage of if we give it the opportunity. So please pay attention to what was in the video, maintain our strategies to protect ourselves and our families and our loved ones from the virus, and we will move forward at an appropriate and responsible pace along with our partners at the federal level and in the pharmaceutical industry. Thank you.
Chief Pena, you want to come and give us a report with regards to the fire department?
Thank you, Mayor. Thank you for your leadership, certainly, and the work that the HPD has been doing in regards to domestic violence. It is encouraging news, Dr. Peirce, that Pfizer has been conducting their trials on their vaccine, and hopefully we will get one soon. Our numbers, for our firefighters in quarantine, are following the same trends as the cities overall, and we've had an uptick. Today we're at 80 firefighters in quarantine. A week ago we were at 60. So again, I want to encourage, as the mayor has been doing, for us to continue practicing the best recommendations that we have at this point, which is wearing your masks, social distancing, and proper hygiene. We've seen what's going on in West Texas. The numbers of coronavirus exposures and deaths are spiking. We want to avoid the same thing to happen here in Houston. Okay, we're moving in the right direction. We're holding what we have, but we have to continue being vigilant and being diligent in our safety approaches. That's my report. Thank you, Mayor.
So let me just say that this virus is impacting communities in so many different ways. But with respect to domestic violence, with respect to mental health issues, emotional issues, the anxiety and stress levels are very, very high. So we are doing everything we can to tamp that down. Let me also say that I received not too long ago a call of reported shooting on our streets. That I know Chief Acevedo, Chief Fenner, as well as Chief Slinker are investigating right now, waiting to get more information on that. And Chief Bambridge may have some additional information. I do not know. But again, let me just say there are a lot of things that are happening on our roadways, on our streets, road rage, you name it. So let me just encourage everyone to really take advantage of all of the services that we are trying to make available to kind of calm people down and just be mindful when you're on the streets, on the roads, not to engage in any sort of arguments or anything of that nature on our streets, on our roads. So just be mindful of that, and just be very, very careful.